I want to thank you all for joining us here today for the annual Summit on Balanced Pain Management.
I love this saying from Maslow, if all you have is a hammer, every problem looks like a nail. And what's happened in healthcare, particularly around pain, is we've gotten stuck on using the hammer, the opioids, for every problem.
We have to have a better way of communicating and make our needs known.
Well, I think breaking down the barriers of communication between our medical colleagues and the other healthcare providers, working in a collaborative, patient-centered mindset.
It's a cost benefit to provide good quality multidisciplinary care, and it's optimal for the people who have pain.
That's where I'd like us to be in 10 years. Good pain treatment's the rule, not the exception. And that we look back on the past and it's like, how silly we were.
It's a matter of changing the perspective on those who have substance abuse disorders.
There's really an educational component that needs to be shared between the patient and the lawmakers in order to have them both come together and create sound policy that's really going to provide safe and fair access for all consumers.
Voices like yours, though, are important to people like me. People ask me all the time, well, what can we do? The best thing you can do is provide us information about your area of expertise, because that helps us craft better public policy.
Abuse-deterrent formulations are not for addicts, and abuse-deterrent formulations are not for patients. What they do is they serve the public health benefit.
How do we get providers to ask the tough questions about, addiction and kind of really digging deep to understand what the patient's pain experience is really important.
I was a slave to hydrocodone. I got sober on April 1st, 2012. I've been sober since because I do the same thing every day. I go to meetings, I talk to people when there's a problem, and I'm of service to others. This has to do with somebody in this room who may be struggling, somebody in this room who may know somebody who's struggling, who needs some sort of solution.
So as we bring this to a close today, I'm struck once again by how much tremendous work and progress is being made. And really looking forward to 2017 because I think there's so much here we can build on. So when we come together at our next summit, even be bigger and better than this.